Hello everyone, my name is Aarti and you're watching HW News. Prime Minister Narendra Modi emphasized on the need for population control in his Independence Day speech in 2019. Since then, the discussion and debate around a possible policy to control the growing population of India has gained pace. Just 3 months after Prime Minister's speech, BJP MP Ajay Bhatt, who is now a union minister, had introduced a private member's bill in Lok Sabha seeking to limit the number of children per married couple to 2. This bill was moved amid the debate over Uniform Civil Code. This bill proposed incentives for those having 2 or less than 2 children and some drawbacks or disincentives for those who have more than 2 children. This was in 2019. Now cut to 2021. In January this year, the Uttar Pradesh State Law Commission said that they were examining the feasibility of having state enactment for population control. On Friday, it released the first draft of the proposed population control bill. Suggestions have been invited from the public to improve the draft bill, and July 19th is the last date for it. What provisions are proposed in the draft bill? Let us talk about it. But before that, if you are watching this video on YouTube, please make sure you like this video, you comment below it and you subscribe to our channel. And if you are watching this video on Facebook, please do like our page and share this video to as many people as possible. Let us talk about the bill. Now, this bill seeks to revitalize the efforts and provide for measures to control, stabilize and provide welfare to the population of the state by implementing and promoting two-child norm. The draft bill reads, and I quote, "In Uttar Pradesh, there are limited ecological and economic resources at hand. It is necessary and urgent that the provision of basic necessities of human life, including affordable food, safe drinking water, decent housing, access to quality education, economic livelihood opportunities, power or electricity for domestic consumption, and a secure living is accessible to all the citizens. And thus, it is imperative to have two-child policy or population control." Now, there are certain incentives for public servants. State government employees who voluntarily undergo sterilization and adopt the two-child policy are eligible for following benefits or incentive, like 2 additional increments during the entire service, subsidy towards purchase of plot or house site or build a house from Housing Board or Development Authority, soft loan for construction or purchasing a house on nominal rates of interest, rebate on charges for utilities such as water, electricity, house tax, etc., maternity or as the case may be, paternity leave of 12 months with a full salary and allowances, 3% increase in the employer's contribution fund under national pension, free healthcare facility and insurance coverage to spouse and such other benefits and incentives. Now, there are certain additional incentives given to public servants. Those state government employees who have only one child and undergo voluntary sterilization operation upon himself or spouse may get further benefits in addition to the ones I cited above. For example, 2 additional increments during the entire services, that means total 4 increments for them. Free healthcare facility and insurance coverage to the single child till he or she attains the age of 20 years. Preference to single child in admission in all the educational institutions, including but not limited to Indian Institute of Management, All India Institute of Medical Sciences, etc. Free education up to graduation level, scholarship for higher studies in case of a girl child, preference to single child in government jobs, etc. Now let us talk about extension of incentive for non-public servants. Those who are not the state government employees but still adopt the two-child policy and undergo voluntary sterilization operation will get soft loan for construction or purchasing a house on low interest rates, discount on water, electricity bills and house tax, maternity or paternity leave fully paid with allowances, and those who are not public servant and still have one child will get free insurance and health cover, preference in admission in educational institute for the child, free education up to graduation level, scholarship for the higher studies if a girl child, and preference in government job for the single child. Couple living below the poverty line having only one child will get 80,000 rupees lump sum amount in case the single child is a boy and 1 lakh rupees if it is a girl child. Now let us talk about the disincentives. those who have more than 2 children will face debarring from benefit of government-sponsored welfare schemes, limit of ration card units up to 4, other disincentives as may be prescribed. Now, in case if someone violates the two-child policy after the enactment of the law, he or she shall be ineligible to contest the election to local authority or any body of the local self-government. This will, however, not apply in case of an individual who is already a member of local body or any body of the local self-government. If any action of a member of a local body or any body of the local self-government violated the law, he can be debarred from his post. Furthermore, if you violate this, you will not be eligible to apply for the government jobs under the state government. You will not be eligible for promotion in the government job, and there will be a bar on receiving any kind of government subsidy. There are certain exemptions too, like multiple births out of second pregnancy and adoption. If the first or the first 2 child are disabled, then third pregnancy will not be considered as a violation, and in case first or first 2 children have died, then the third pregnancy will not be considered as a violation. There are also provisions for polygamous and polyandrous marriages as well. Now, the bill also talks about some government duties. Listing out the government's duties, the draft bill says that the maternity centers will be established at all the primary health centers. The centers and NGOs will distribute contraceptive pills, condoms, etc., spread awareness about family planning methods through community health workers, and ensure mandatory registration of pregnancies, deliveries, births and deaths across the state. The draft bill also says that it shall be the duty of the government to introduce a compulsory subject relating to the population control in all of the secondary schools, and it also asks the government to also ensure the availability of contraceptives in every village and every district. Now, it is important to note that the bill comes in the backdrop of a Delhi High Court backing the Uniform Civil Code, and also when the assembly election in the state is just few months away. How will this affect the assembly elections? One has to wait and watch. Do let us know what you think about this in the comment box below. For more news and updates, you can log on to www.hwnews.in.
पता है, इन सब लोगों में एक चीज कॉमन है। गैस करिए क्या? नहीं पता? चलिए एक हिंट देती हूँ। ये सब आपके परिवार से जुड़े हैं। अरे, फिर भी नहीं पहचाना आपने इन्हें? चलिए कोई बात नहीं। वैसे भी ये लोग पर्दे के पीछे ही तो काम करते थे। इन सब की डेथ हो गई है कोविड से, ताकि आप और आपका परिवार सेफ रह सके। और यही तो है परिवार का मतलब, अपनों की रक्षा करना। जो हमारे लिए जान दे सकते हैं वो अपने सगे नहीं तो फिर कौन है? Mumbai Police.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.